Actor Chuck Norris and his wife Gena are now suing several medical companies after they say that she was poisoned by a drug used during a routine MRI scan. The drug is a contrast agent. It enhances MRI images and helps with the diagnosis. Werner is here with a look at the debate surrounding these drugs and why the doctors say they are part of an essential toolbox that is used to save lives. Anna, good morning.
Well, good morning. The companies that make contrast agents say they are safe and have been used to aid in the treatment of millions of patients. But the Norrises aren't the only ones complaining about side effects from the routine medical procedure. Gena Norris, in particular, hopes their lawsuit brings more attention to the issue.
In movies, Chuck Norris fought martial arts masters. But now he's taking on medical companies along with his wife, Gena.
I couldn't think anymore. Any type of cognition, being able to articulate, my memory, I had muscle wasting.
She says she was poisoned after a routine MRI.
Nothing's going on here. She's dying. She's dying right in front of me here at this hospital.
MRIs help doctors diagnose disease by taking pictures inside the body. Sometimes doctors inject a drug called a contrast agent during the procedure to get sharper images. The Norrises blame a gadolinium-based contrast agent for her health problems, saying in their lawsuit that she developed gadolinium deposition disease, with symptoms including burning pain, violent shaking, and confusion, along with kidney damage. Norris attorney Todd Wahlberg.
We have clients who have been misdiagnosed with Lyme disease, ALS, and then they've eventually ruled all those things out, and the culprit remaining is the gadolinium.
Drug distributor McKesson said it's reviewing the complaint and will respond in a timely manner. The maker of the drug said it takes patient safety very seriously and stands behind the safety of all its products. CBS News medical contributor Dr. David Agus.
What we know is that gadolinium, this dye that's used, can actually deposit in tissue. That's known now. What we don't know is that it actually is associated with symptoms in patients.
Dr. Agus says he doesn't want patients to be scared of a test that could save their life.
These are critical tests, and I don't want worry initially without real substantive data to actually stress people out.
Gena Norris agrees.
We don't want to see that go away. I mean, it saves, countless lives, and that needs to stay.
But she says had she thought there were risks, she would not have allowed the drug to be used.
For all those people that are thinking about getting an MRI, there needs to be some stricter warnings.
Well, the FDA started looking at this in 2015 and earlier this year said it had not identified any harmful effects from gadolinium that stayed in the brain. But in September, an advisory committee did vote to change the drug labels to warn that some of the chemical may remain in certain organs, including the brain, and recommended risk minimization steps for specific, more sensitive patient populations. So I think the jury's still out.
But at least it's something that patients can talk to their doctors about and maybe ask them about it
before
an
an
MRI.
Of it, especially if you have kidney issues, then you really want to talk to your doctor about it.
Anna, thank you.